Hello beautiful people, welcome again to this amazing channel. Today I'm going to talk about a very important issue. This involves our female or our spouses. So have you been experiencing regular vaginal bleeding or continuous or recurrence with UTIs, or even recurrence with genital warts? Like you have genital warts that comes again, you treat them, they comes again, you treat them, they come again. Or even having menstrual period that is very painful and sometimes exceeds, or sometimes have very heavy bleeding during menstrual period. Or even sometimes you feel you have pain during intercourse. When you are having your man, you feel so much pain. Or even having recurrence in discharge, vaginal discharge, which is sometimes pink or brownish in color, and sometimes you feel like it's have a very bad smell. Do you have a recurrence, or you feel every time you have lower back pain? Or even sometimes you feel you have lower pelvic or pelvic pain that is consistent, sometimes on and off. This might be chances of you getting serious about this issue, or even getting more cautious, because these are signs and symptoms of cervical cancer. Why am I saying you need to do this? You need to go to the nearest hospital, get tested. What are the kind of tests that you'll find for the cervical cancer? There are two major tests that you can do. The first one is pap smear, and the second one is HPV virus test. The reason I talked about recurrence in genital warts, it's because genital warts are mainly caused by HPV virus type 12. And the same HPV virus is the one that causes cervical cancer. So if you have been having this problem, so know it might be risky for you. Okay, what happens when you go to the clinic or to the facility or medical facility for the test? The doctor will take some small specimen from your cervical area, so that they can conduct these two tests. I talked about pap smear and I talked about HPV virus test. So HPV means human papilloma virus. So what other thing can you or why is it important for us to do this test? It is important because actually cervical cancer is increasingly becoming an issue in our society. The first thing is because most of the women being affected is 35 years all the way to 65 years. But the biggest population is between 35 years to 45 years. And doesn't mean a younger generation cannot be affected. Women between 20 years and 35 years also are getting affected with cervical cancer because of this recurrence of UTIs and all these sexually transmitted HPV virus. Okay, so you need to check this. Why do we need to also check this in the hospital? When we take the specimen, we will determine what we call precancer cells. These precancer cells, if they are found positive, we will start early treatment on you, so that we can prevent these precancer cells from becoming cancerous. Because when they become cancerous, now we cannot be able to cure this. We will start giving you radiotherapy and chemotherapy, which is not very conducive financial wise, and also it lowers the quality of life. So we want to be very careful on this. Please, if you see these symptoms, kindly, please make sure you go and get tested. Thank you for always listening to me. Today I wanted to talk about the cancer and the importance of this. Please remember to subscribe on my YouTube channel. Check on my account. You will see a TikTok account. You will see a YouTube box. Click on that and subscribe. On the other side, you can go to YouTube, your YouTube application, search for the name Dr. Cyrus Nyaga Media or Cyrus Nyaga Media. Subscribe, and guys, I will appreciate it. Thank you for always watching. Next time we are going to talk about cervical cancer vaccination. Thank you. See you on the next video.